Good morning, everyone, and welcome to this remote meeting of the Children and Young People's Overview and Scrutiny Committee. This is taking place on the 9th of October 2020 and is being recorded live to the Council's website. It'll be available to be viewed for a minimum of 6 months. Please be aware that any footage from the meeting can be used in subsequent media broadcasts. I'm Councillor Heather Smith and I'm the chair of this committee. I'd like to warmly welcome all members, officers and any members of the public or media who are watching this live feed. So welcome to everybody. Before we start the formal business on the agenda, I'd just like to go through some of the housekeeping issues for those who may not be familiar with them. We request that all participants mute their microphone and, where possible, blur the background. If you wish to speak during the meeting, please use the chat function on the right-hand side, and if you type RTS, request to speak, then we will know that you wish to speak. Please remember that everyone in the meeting can see the messages in the chat function. When invited to speak by me, please unmute your microphone. And once you've been invited to speak, please introduce yourself with your name and your position, unless you've already spoken earlier in the meeting and introduced yourself before. If you're having any issues with connectivity, please try switching off the video and just using the telephone function. Excuse me. If connectivity issues continue, then you may have to leave the meeting and then rejoin to get a better signal. And if my connection is lost, then the Vice Chair of the committee, Councillor Christine Potts, will take over until my connection is restored. So before we start the formal agenda, I'd like to welcome and introduce the officers who are here to support the meeting. We have Michelle Traynor, who is the Head of Service for Children and Adolescent Mental Health Services in County Durham and Darlington, and Michelle will be presenting to us. Martin Stenton is here. He's the Head of Early Help, Inclusion and Vulnerable Children. Karen Davidson will be presenting to us. Karen is the Strategic Manager of the One Point and Think Family Services. We also have John Mitchell, Research and Consultant Officer. Stephen Tracy, who will be presenting. He's the Corporate Equalities and Strategy Manager. Andrew Baldwin is the Finance Manager for Children and Young People Services, and Andrew will be presenting to us. Tom Gorman is the Corporate Scrutiny and Strategy Manager. Jill Errington is the Senior Committee Services Officer. Anne Witten is the Overview and Scrutiny Officer. And I think we may have with us, so I can't see her on the screen, but she may be with us, Councillor Alwyn Gunn, who is the Cabinet Portfolio Holder for Children and Young People Services, and Councillor Maura McKeon, the Cabinet Support Member for Children and Young People Services. So welcome to everybody. The first item on the agenda is apologies for absence. Have we received any apologies?
Chair, we've received apologies from Councillor Peter Atkinson, Jan Blakey and Audrey Willis, and Co-opted Member Miss Jo Bruton. And from Adults Wellbeing and Health Overview and Scrutiny Committee, we have Councillors Jeanette Stevenson, Christine Wilson and Jean Chaplow. Thank you.
Thank you, Jill. Do we have any substitute members?
We have no substitute members, Chair.
Thank you. Item 3 is the minutes of the special meeting that was held on the 7th of February 2020 and our meeting that was held on the 2nd of July 2020. I hope everyone's had a chance to read those. Can we agree the minutes as a correct record? People nodding? Yeah, thank you. Are there any matters arising? I think Anne's probably going to tell us that.
Thank you, Chair. There's no matters arising.
Thank you very much. Item 4 is declarations of interest. Do we have any declarations? No, thank you. We'll move on. Item 5 is items from co-opted members or interested parties. Have we received any such items?
No items have been raised, Chair. Thank you.
Thank you, Anne. So item 6, this is the first of our really interesting and very important presentations that we're having this morning. This is about child and adolescent mental health services and an update from Michelle Traynor, who is the head of service for CAMHS for the county. So over to you, Michelle.
Hello, thanks, Chair. And my Director of Operations, Jennifer Illingworth, is also on the call, and we're going to joint share the presentation.
Thank you.
So just to update on that. So hello, my name is Michelle Traynor. I'm the Head of Service for Child and Adolescent Mental Health in Tees Esconwea Valley NHS Trust. That covers Durham and Darlington. And for the purposes today, the presentation we're sharing is around Durham. So Anne's going to support me and Jennifer in the presentation. So can we start yet? Thanks. I'm not seeing it. I don't know if anybody else is.
I can see it, Michelle.
I can see it, Michelle.
Right, I can't, so that's fine. I'll go to my own copy.
Got a copy.
I have. Back up. No worries. Okay. Are we on the second slide, Anne? I love technology.
We are now.
So the overview and update.
Yeah.
So we're going to, the presentation over the next 10 minutes is going to cover our current waiting time position in CAMHS across Durham, where we're at with transition planning from child and adolescent mental health services to adult mental health services. Jennifer's going to give us an update on West Lane Hospital and also finish off with an impact on COVID-19, what COVID-19's had on the service, both the good and the not so good. So next slide, please. So just to keep in context, we have across Durham and Darlington a single point of access, which is where all referrals to child and adolescent mental health come. And that's an open referral system, so it can be from anybody at all, young people, professionals, associated, people working with children and young people and families, so anybody can refer to our service. There's no criteria around that. I guess what I want to highlight today is that during the 6 months we were kind of COVID, or the initial stages of COVID, our referral rates dropped quite significantly from approximately 100 a week. It's just to reference that we're now back to that average of 100 referrals per week into our service, and that's increasing day on day. After a referral comes in, we aim to do an initial assessment, either over the phone or face-to-face with young people and their families within 10 working days. We're currently achieving that target, but only just. If referrals continue to rise, we are going to see some extended waits there. What we're doing currently is we've had a small amount of additional investment from the Mental Health and Learning Disability Partnership recently. So we're currently recruiting some additional staff that will be protected to work right at the front end of our service and in collaboration with our partners. So with local authority colleagues and their early help conversations within our multi-agency safeguarding hub in Durham and across schools. to try and make sure that we can get young people's needs met at the earliest opportunity within the right service. And at times that's not always my service in CAMHS. Often, you know, their needs could be met earlier and more appropriately by services within schools or other areas. So we're working really hard with that. So we do have some plans in place. Moving on to the young people who are referred to our service and how long they wait. 25 to 30% of the referrals coming into our service are their needs would be met with what we describe as mild to moderate interventions for low mood and anxiety. So cognitive behavioural therapy, parent-led cognitive behavioural therapy for young children. Those young people who are referred come into two parts of our service. Some people may have heard of our new mental health support teams in schools that we were really lucky to be to kind of start that project beginning of the year. It's been a challenging project given COVID-19 and schools being closed, but that project now is well underway. The staff have got training via the university under their belt. They've got some practical training as well. So we're now moving out into schools. So we have a resource that's now out in some of our schools across Durham who will be providing them mild to moderate interventions, and any young people within that remit will be seen within 2 weeks of their referral. For any young people who are not in schools that have an MHST or are not in education or are in our 16 and 17-year-old age range, we have another resource called our Children's Psychological Wellbeing Practitioners. They are trained in the same way, so whether you hear mental health support teams, educational mental health practitioners or psychological wellbeing practitioners, they are all trained in the same intervention skills. So what it means is between those two services and two resources, any young person under 18 across Durham does have access to mild to moderate interventions for low mood and anxiety, I guess, and within 6 weeks of being referred. 20 to 25% of our referrals are for our young people who present with quite complex mental health or learning disabilities. They will receive that initial assessment within 10 working days currently, but from that assessment to the waiting time to treatment is currently ranging between 10 to 18 weeks within our community teams. And we have 3 community teams that sit across Durham, one in Easington, one in North Durham that also has a satellite base in Consett, and we have the Ackley Centre that's based in Newton Aycliffe in the south. Our 10 weeks range is in Easington, just so people are aware of where that range comes from. So the 10-week wait is in Easington, the 18-week wait is in the North Durham area. We're working really hard to try and manage that in kind of another way to make sure that those needs are being met. So we have a whole transformation agenda currently undergoing that we are happy to come back and give an update at some point in the future of where we're at. But there's some real positive plans around bringing that all down to within a 6-week. So the aim that we're going for in our vision will be that all complex mental health interventions will be receiving treatment, all young people will be receiving treatment within 6 weeks from assessment. To highlight that our crisis intensive home treatment and what we now have is a positive behaviour support team who support some of our young people with really complex learning disabilities. They have been and still are maintaining a 24-hour response and are achieving the targets and the time. So if you present in crisis, you will receive that crisis assessment within 4 hours. Next slide, please. In terms of our specialist autism, ADHD and cognitive assessments, and I'm very aware for many people watching this is our biggest challenge in Durham, but it's also the biggest challenge nationally, in that the assessment for autism and ADHD and parts of cognitive assessments for young people have absolutely come to a halt during COVID because of the restrictions and the clinical validity of being able to do some of these assessments in a mask. To be kind of in simple terms, I guess now what we've got is we've got some different technology that's being created by clinicians nationally, and we've now got PPE in the form of screens, so we are moving forward. So we are now back to being able to see young people and continue and finish that assessment that possibly started pre-COVID lockdown. I guess what we've got though is a backlog. So to be really transparent in where we're at, autism assessments for Durham, the current longest wait is 53 weeks. Many of the young people who are waiting have had parts and elements of that assessment. So any part of that assessment that could be done during the restrictions has been done. So the trajectories attached to the longest wait, hopefully over coming weeks and months, will reduce. But we do have an enormous task, and again, it's a national task in making sure that we get back on track and reduce these waiting times. ADHD and cognitive assessments, they're reduced now to 15 weeks, which still seems quite a long time. So I'm not sitting here saying it's not, but I guess where we're at is that's part of an assessment. There will be other work going on for those young people as well. Next slide, please. Our second point was around where we're at with transition from CAMHS to AMHS. There's a phenomenal amount of work going on across partner agencies in relation to how we move forward. But just to give a brief update on where we are internally within CHUV, our adult mental health and child and adolescent mental health locality managers across Durham are leading on a joint review of the current processes. We've got proposals to include that transition start at 17 years. Currently it starts at 17 years and 6 months for somebody who's moving across services. So looking at how we bring that forward. We're doing a refresh of the transition panels that we have across the locality. So those are panels where we have regular groups of multidisciplinary staff discussing young people and what's going to be best for their next steps. I guess the other element of that is to increase the family and carer involvement in those decisions and discussions, and to look at what else we could be doing. Can we be doing things differently? And I'm sure we absolutely can. And we also have something that's very different to what we've had before, a personality and relational psychologist reviewing all of the care records of young people transitioning, and that gives a completely different element to that planning with the young person and the family, as well as their needs that are identified. So just really looking at what are the possibilities to make sure that we get that young people get the best possible transition and get their needs met with the smoothest journey. So I'll hand over to my director, Jennifer Illingworth, to go to the next slide, please.
I'm on mute. Sorry, that was a schoolgirl error. Sorry, I've just talked for 10 minutes. Apologies, Chair. So I'm Jennifer Illingworth. I'm the Director of Operations from Durham and Darlington, working with Michelle. I'm just going to give you a quick update on what's happening with the West Lane Hospital. I appreciate Michelle's probably talked for our 10 minutes, so I'll be as brief as I can, but happy to take any questions. So as I'm sure the committee are aware, the West Lane Hospital, which is our inpatient site for children's services in the CHUV footprint, was closed last August. So it's been closed for just over a year now. So the update is just to tell you what's happening with the plans to reopen some beds for our locality. So as the slide suggests, in September this year, NHS England and Improvement have announced a step forward in restoring some of our inpatient provision into our region, because obviously we are struggling without some of the beds that have been closed for the last 12 months. And NHS England did an option appraisal and put some work out for tender, for want of a better word. And I guess There's going to be an interim provider of the inpatient bed provision on the West Lane site in Teesside, and it's going to be Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust, who are the mental health trust to the north of us. So they've won the tender to provide that bit of work for a period of I believe it's 3 years. So we are still, as an organisation, TUV are still not in a position to be able to provide the CAMHS inpatient services ourselves. And I guess the main reason for that is we're still there's an ongoing independent investigation to the reason that it was closed in the first place, which has been commissioned by NHS England, but it's still it's probably not even halfway through at the moment. So we still think it's going to take some time for that to complete, and until that investigation has been concluded, we are not personally in a position to be able to open those beds, but CNTW, our neighbouring provider, can do that on the behalf of all the young people, I guess, in the region. And I guess the reason that we are doing that is because taking those beds out of the system, because obviously children and young people's beds, it's a national ask rather than a local ask, but it has had quite a significant impact on us trying to find beds for young people. And often they go quite far away from home. So I think NHS England and Improvement have recognised that, and that's why they've taken the step forward that they have. We do still have some community services on the West Lane site, so we still provide community services as Michelle has just described in Durham, but also in Teesside. So they base some of their community teams there. So we do still have a presence in the West Lane Hospital site, but we won't be providing the inpatient beds at this time. I don't have an update as we speak about when that will happen and when those beds will open, but we'll keep the committee abreast of that as things progress. So that is just a little bit of an update on where we are with the inpatient provision for our young people. Can I have the next slide, please? No. Thank you very much. And this is just the last slide was just about the impact of COVID on the CAMHS service. So I guess it's split there quite nicely into positive and negative impacts. So from a positive impact, and I think this is true of most of our services in mental health and probably in the wider health economy, the use of technology and how we've done things in a more creative way to try and make sure that we keep our contacts with our young people and their families going. We're still learning the impact of that, so we're still sort of assessing. It's probably more successful with some types of young person than others, depending on what people's needs are, but it's certainly been very successful, and it has helped us keep the ship on the road, if you like, or the ship in the water, to try and keep things going during coronavirus, because I think we would have really struggled across all of our services if we didn't have that. Autonomy of staff and flexibility of the workforce. So again, we've seen this across the board, how staff have sort of flexed, they've been gone over and above, people working out of homes, taking turns going into offices, all of those things that, again, I'm sure that others are doing exactly the same, but I think people have really risen to the challenge of trying to keep our services going and working very differently to support people, and people have done, you know, various things to try go that extra mile, really, to try and make sure that we support people as much as we can. I guess the negative, Michelle's already touched on, the impact on some of the waiting times, particularly for autism assessments, due to the fact that the assessments aren't valid when people's faces are covered and things like that. So Michelle's obviously explained a bit of what we're trying to do to counteract that now. And then also it's the isolation of staff and also young people and the families. So isolation in general. You know, not all staff want to work from home all of the time, or any of the time, particularly people like interactions with other humans, and similar for young people and the families. Some people thrive being at home all the time, some people absolutely don't, and we've got a mix of that, and I'm sure again that's very similar to other services. And I guess one last thing that's not on this slide mainly is just the current impact of COVID. So we're in the second wave now, I guess, and I know that Michelle is finding we've got some staff who are off who have tested positive for COVID, which we didn't have in the first wave. To be honest, we got off quite lightly in Durham as far as staff being affected and patients, and we now have patients and staff who are being affected. But I know from Michelle's team particularly, which is what we're here to talk about today, we are struggling a little in some of the teams because we have had a little bit of we had some staff who've tested positive. Luckily, they're well positive. They're not poorly with COVID, but it does have an impact on how we have to rob Peter to pay Paul with teams and move people around to try and keep the service going. And I think that might be the last point. I think the next slide just says any questions or thank you, if I remember rightly.
Thank you very much, Michelle and Jennifer. Questions, if people would like to ask a question, please type request to speak RTS in the chat function. Ivan.
Yes, thanks very much, Chair, and thank you, ladies, for your presentation. That was very interesting. I'm interested to drill down a little bit, and you talked about the complex cases. I think in the North Durham area being 18 weeks, where South Durham, I think it was 10 weeks. Why the discrepancy, and are we likely to catch up on that or reduce the waiting time for North Durham in the near future? And can I also ask, we talked about autism assessment being at 53 weeks, which excuse my naivety, but it does seem rather a long time. Is this totally due to the COVID situation, or was it high prior to that? Thank you.
Thank you. In response to your first question, the waiting times to treatment for complex cases pre-COVID, we were actually running at over 24 weeks. So there is an improvement there. The difference across the county is due to the number of referrals into that area. So it's purely based on the needs of the young people. So I guess what one of the things we've benefited from over the kind of reduction in referrals in COVID, it's really helped us understand our situations demographically a bit more, and that South Durham has always had far more referrals than counterparts in the area. So it literally is the numbers of referrals coming in for that presentation or higher in the areas where we're waiting longer. However, there is a plan to get us very clearly across the county down to 6 weeks. Now that may well take us a little while and a little bit more resource and investment, but there is a really clear plan in place that I'm feeling really hopeful about that we can achieve. So that would be your first part. And in response to the second question, the waiting times to start assessment for autism pre-COVID, we were running at about 14 to 18 weeks to start that assessment. Now that's a group. So the complexities within the autism assessment is the fact that we still can't do groups. So our longest wait is creeping up. What we can do now is the new individual assessment using the screens and the new developed assessment tool. What we can't get back to is groups. So there's still an element of the assessment that speeded up, for want of a better way of putting it, the waiting times and the waits. What I didn't mention that I will now is we do have a small resource of staff who are contacting and supporting every family member and young person on that waiting list, and providing them with strategies and support. And that's the conversations we're also having with our partners in education, because there's so much that other people and other services can support with whilst the wait for that assessment for diagnosis or not. So we're hoping in the system that we'll be able to support families even though they are waiting for the assessment element. Does that answer your question? Is that helpful?
Yes, thanks very much for that. That's very helpful. Thank you.
Thank you. Next question, please, from Councillor David Hall.
Hi, yeah, thank you. My name's David Hall. I'm a councillor for Sherman Division, and I'm new to the committee, so I'm not asking a question that you've presented to us to this committee before. Hopefully not. And I'd just like to say thank you for all the hard work you've been doing. It must have been tough over this period and unusually, so thank you for that. I just have a couple of questions in relation to suicide, really. It's probably something this committee's covered before, but it'd be useful if we could ask you the question if you don't mind. And that's, I'm just wondering what what the waiting times are in relation to, how referrals normally come in, because obviously you mentioned the crisis team, where you've got 24/7 cover and 4-hour assessments, but actually how long does it take for those young people to get support? And the second thing is, the second question is, do the council commission any support services for children who have had at least one suicide attempt or more than one suicide attempt? And how does yourself or the council liaise with community organisations that might come into contact with young people who might be living with these challenges? Thank you.
In response to the first part of your question around crisis, we now have a crisis line that people can ring into to get through to kind of our crisis team. So that's answered predominantly by a qualified mental health nurse, or there's access to a qualified mental health nurse immediately. So I guess the response that young people can get, or families or carers or anybody associated with a young person who is concerned, they can get everything from advice and guidance immediately right through to that face-to-face assessment within 4 hours. There's more than just that assessment. The model across Durham for under 18s is that we do that assessment, and then we always will follow up and have a second appointment with that young person in an alternative setting, or with people who can support them within 48 hours. And that's really to work on what we all know about adolescence is, adolescents, the world can change very quickly and things can escalate very quickly, but equally they can de-escalate very quickly as well. So we have a model that means that we see that young person in a crisis, but we also see them and follow them up again after that. Now, for lots of our young people, once the crisis is over, there's a plan put in place, and that's sufficient. For young people who need further treatment, they will then their journey will go through our services as I've described. So those other waiting times that I've described for complex needs will be still there. However, if there's risk attached, they will remain with the crisis team, so we can extend for some of those young people. I hope I'm articulating this well enough. For young people who were worried about risk, we wouldn't just sit them in a waiting queue for the next part of their treatment. They will be managed. They have the handheld. We also have what we call our intensive home treatment, which is an extra resource, but it's not just home treatment. We do a lot of community support, school support within that. So we would always be looking at what is the system around that young person that can also support. In response to your specific question around who else and what else, there is some provision across Durham, but it's not huge, and it's clearly an area that we would need to work on. There is some work currently ongoing within the LTP. It was one of our LTP priorities in Durham, around using voluntary sector organisations and how we can work better as a partnership, and that work will need to kind of continue and be picked up. So can't answer more specifically than that, because I'm not aware that we do have that at this moment in time.
Thank you.
Thank you. Bev Coult, please.
Thank you, Chair. Bev Coult, County Councillor for Eshen and Gilbert Ward. I'd just like to thank Michelle and Jennifer for the presentation, and also for the work that's been done during a very, very challenging time. It's just one question, please, Chair, going to Michelle, right back to the beginning of your presentation when you mentioned on the referrals and how at the moment you're just managing to get them done within the 10 days, and obviously you're recruiting more staff, etc. I was just basically, obviously, I personally think the demand for your service is going to just grow and grow and grow. Unfortunately, I think that's not just necessarily at the high end of the teens. I think there's going to be younger teens impacted significantly, unfortunately, predominantly because of COVID and the impact that's had. How long will it take, Michelle, please, for you to actually have these staff in place, not just recruited, but basically live, ready to get involved in taking these cases, please?
Good question. It's more than just our recruitment, and I guess this is where we probably could take the whole of your meeting discussing kind of what else, because I guess alongside our recruitment, which will work, I guess within 3 months, we will have those staff in place, some of them before then. And I guess while this is happening, our internal resource, we often reconfigure and move people to support that front end to make sure that we don't want those waiting times at the front end to go up, because we know that's where we manage risk, that's where we get that first understanding of what that young person's needs are. And often, like I say, there's other services and people that could also help. I think, you know, to add to our recruitment and what we're doing, 30% of the referrals that come to CAMHS come to our single point of access aren't appropriate. The needs of those young people could be met elsewhere. So we're doing a huge amount of work with our partners to look at what else can we do, what else can partners do, how do we work more efficiently across County Durham, how do we have a single point of access that's actually for children and young people, not just for mental health issues, or because often mental health is not sitting alone. The reason they're in our service often can be because there's housing issues within the family, because there are unemployment issues within the family, not things that are within our gift. Actually, we all need to be working together. So there is a lot of work that still needs to be done, but the assurance that I can give today is that those conversations have already started, and we're working really closely with local authority, education and voluntary sector organisations to see what else we can be doing for young people.
That's great. Thank you very much, Michelle.
Thank you. Patricia, please.
Thank you, Chair. Patricia Joplin, Crook Division. I'm quite concerned that the inpatient care that was closed down, the lag between getting something else set up. Can you tell me why arrangements weren't made prior to that closure? You said there's an investigation. I'm sorry, I'm new to this committee, so I'm green on this point. And what did we do with patients that were very ill that needed that care in the interim period?
Okay, that sounds like a simple question, but it's probably quite difficult to answer, but I'll do my very best. So the inpatient wards were closed a year past August because we had some, I guess, serious incidents that happened on the site, and it was decided that at that time it wasn't safe for the young people to stay there until we did some remedial action really to make sure that they were safe. So the young people who were on the site at the time that it closed were all moved to inpatient provision in other providers. So that might have been it's CNTW, which is the provider I talked about in my presentation next door. Some people went slightly further afield than that, but everybody who was in a bed at that time went to a different bed, I guess. And it's out of the control of the trust to be able to reopen the beds. I guess we've got to wait until the investigations has happened that has been commissioned, like I said, by NHS England and Improvement. So we're working to their timescales really, Councillor. So I guess you know, we were hopefully in a position where we wanted to be able to, as an organisation, to reopen those beds ourselves, but as the time has progressed and it's taken longer for that investigation to come to fruition, I think NHS England have, I guess, answered their own question, because there is a shortage of beds nationally for children and young people. The system is finding it very difficult to cope having those beds closed for a prolonged period of time. So the decision was taken by them to reopen the beds in the interim, but with a different provider providing the service. So what that means is, although the beds are going to be within our trust footprint, if you like, so that it's our trust building, etc., it will be managed and staffed by a different organisation until the investigation's completed.
Thank you. Can I just come back on that, Chair, just to ask, in the interim period, which is over a year, has this affected the suicide rate in youngsters or people with mental health?
I'm not sure we could make a direct link to the suicide rate of youngsters and the beds being closed. I guess the one thing it has affected slightly is finding beds for young people in our region. So if we do have somebody within Durham who needs an who's been assessed, through Michelle's team through crisis to need an inpatient bed, it often can be a tricky process to go through to find them a bed, because often they're having to go to Leeds, to Hull, further afield than that sometimes to find a bed. So the process can sometimes be quite protracted. But saying that, I think the process was probably quite protracted even when we had the beds, to be honest, because the beds are controlled nationally, not locally. So who goes into a bed is decided by people other than us. It's decided by NHS England and Improvement. So, but it has caused impact on the wider system, having, you know, a considerable chunk of young people's beds closed. So I think that's why they've made the decision to reopen in the short term. But I don't think we can make any direct link to young people coming to harm because the beds weren't opened, because I don't think it's a direct correlation at all.
Thank you for answering that. I know it was a difficult question. Thank you.
Sorry, thank you.
Thank you. Stephen Gwilym, please.
Thank you, Chair. Stephen Gwilym, Principal Scrutiny Officer at Durham County Council, and I provide support to the Adult Wellbeing and Health Scrutiny Committee. Chair, I just wanted to reference a couple of issues relevant to the debate that you've just had in respect of the Council's response to TUVE's quality account document. That was submitted to TUVE on the 19th of September and specifically referenced issues related to the retention of the quality account priority related to improving the clinical effectiveness and patient experience for times of transition from children to adult services. So obviously, clearly, that's an issue that's been highlighted in today's presentation. But I think also, Chair, in respect of the conversation you've had around mental health crisis, the quality account document referenced a significant investment within County Durham and Darlington to the tune of around £2 million, which was specifically allocated for strengthening services in respect of those services to people in mental health crisis. So it's particularly relevant to those discussions you've had around crisis services. So I just wanted to highlight that, Chair. Thank you.
Thank you very much, Stephen. And Councillor Huntingdon, Eunice.
Good morning, everyone. Can I just first of all say thank you for the presentation. I think it raised my awareness of some of the difficulties that you face, but also some of the people that need the service. I've been involved with, I think it's 5 different people who needed the service in my area. And when you say 53 weeks for assessment and so on, I understand your difficulties around that, but I've also seen firsthand the difficulties that this poses for the families. And also once they have been assessed, because some of them are quite complex, certainly one that I was involved with, and it's finding a placement for them. And that again has been, well, I'll say a nightmare really. And you've got to feel so sorry for the parents. One family had 2 children and the difficulties that it posed for them. But I just felt as though it really didn't get to the bottom of their problem. It didn't help. I hear what you're saying and I thoroughly understand, but we've got to look and see the problems that's caused for families who sort of locked in with these young people.
Chair, if I can respond, yes, I would absolutely echo everything that you're saying. It doesn't sit comfortably at all with us from a service perspective, kind of the position that we're in. And we do work very closely with our parent care commissioned group Rollercoaster, and I'm very well cited and attend that regularly to know some of the challenges and speak really kind of, you know, one-to-one with some of the parents, and I guess it's understanding sometimes that the service that CAMHS, my service, provides for autism is only the diagnosis, the assessment and diagnosis. And I think what we really need to move away from is the assessment and diagnosis and think about the needs of the young person and their family. and what are the services and who else can provide that support for that family. Because yes, assessment and diagnosis are incredibly important, but it doesn't change how families manage, I guess, at home, day in, day out. So I totally agree that we need to look at the wider system. Who else, what else can we do to support that family and that young person, and some of that will be gaps in commissioning, some of that will be gaps in services, and that we need to look at moving forward.
So can I just thank you for that? That was good, but it's the gaps in the services that I'm interested. Thank you.
Yeah,
thank you. And the final question from Councillor John Robinson.
Thank you very much, Chairman. John Robinson, Chair of the Adult and Health Scrutiny Committee. First of all, can I thank you, Heather, for inviting myself and the other colleagues to join your meeting for this topic. I appreciate it, and I'm delighted there's several of us here. There's two issues I'd like to raise, but they're both linked. As Stephen said, the concern from the adult health is the transition period, and we're very concerned about young people 16, 17, moving into the ages of 18, 19, and also obviously people with learning difficulties, and the fact that their age, their adult ages classes in 2021. We wanted to know, is there more funding coming in? Is that service going to be strengthened so that young people are not lost in the middle? We often find in transition young people are lost. And secondly, we've done a lot of work in regards to adult suicide and young people's suicide 18 and above. Nobody, and I appreciate Cramlington is not your area, but I don't think anybody could have not been heartbroken and cried to see that young family on the television this week with the young 12-year-old. Are we strengthening our support to young children in regards to bullying, etc., so that there would not be another repeat in Durham? Because certainly we have had a major concern in adult and health about the young men, particularly young men that have been committing suicide. So that is the two concerns for us. And once again, thank you, Heather, for allowing us to join your meeting.
Michelle, could I take the first bit about transitions? Because obviously I'm doing a bit of regional work about that, and then you could maybe do the bit about the bullying and the work that you're doing with schools, I guess. So thanks for the question. I guess just to build on what Michelle's already talked about transitions to a certain extent, but I guess there's a wider bit of work going on in the region. So in the region, we are part of the ICS, which is the Integrated Care System, which covers from Northumberland through to Teesside, and we're obviously in the middle of that. And they've got specific work streams and priorities for mental health, and one of them is the one that I'm on, which is the first work stream, which is the 0 to 25 age group. So what they're trying to do is that we cover, I guess, children's lifespan from being born, or from before being born, really, from maternity through to 25. And I guess the bit of that work stream that I'm particularly interested in is the 16 to 25 group, and it's how we start to treat young people as still being young people once they hit 18, because we know we have a lot of issues, because just because somebody's just turned 18 doesn't make them suddenly very different to what they were the day before they were 18 or the day after. So I think it's looking to make that 16 to 25 more of the young person's age group, rather than the up to 18 that we currently have in health. And I know it's different in social care. And I guess one of the things within that, in the transitions work, and you talk about additional investment, so what we are doing at the moment in TUV, we've just asked for some money, and I'm 99.9% we're going to get it, but don't quote me on that. But I guess to put some specific transitions workers into each locality, and so what we've asked for are 2 transitions clinicians to be based in each of our geographical localities, obviously Durham and Darlington being one of them. And their role will be to work with the community CAMHS teams that Michelle manages, but also to work with the adults community teams. And they will, I guess, almost handhold and signpost the young people as they come through the service. So as they come from sort of being 16 plus, they'll work with the young person, work with their families, but also work with the adult teams, and they will be with them for their assessments, with them to meet the new staff as they move through the teams, and they'll stay with them as long as they need to stay with them, so that they will have their own sort of individual caseload. So that's going to be put in place hopefully within the next, well, hopefully by by Christmas or early in the new year. So that's a really new development that we've just got the money for. We're working, some other organisations have got a model that they've already used, some organisations a bit further south than us, so we're going to sort of crib their model and try that out. And then if it proves to be successful, which I can't imagine it won't, then we'll look at what we need to do to bolster that service up. But I think what we've worked out in Tube, and I'm sure other organisations are the same, is trying to manage transitions in a really successful way within the existing resource of the already overburdened teams we've got in both children's and adult services. It just becomes another thing to do that's unmanageable. It needs some dedicated resource, so that's what we're trying to do now.
Thank you.
So that would be my bit. So Michelle, did you want to talk about the bullying bit?
To pick, I think just to add to what Jen said as well around that comment is, like, we need to think needs led in everything that we're doing as well. I think sometimes, you know, we have to move away from that chronological age and think
some
needs.
People will be 18 and they'll be very grown up, and some people will be 18 and they'll be like they're 12 or 13. So
yeah,
you can't assume everybody's the same.
Absolutely. And you know, in response to your question around age and how we, in terms of young people that have taken their own lives, and I guess where we're at is it's been ongoing for the whole of my 27-year career. This is not something that is new, unfortunately. And I think, you know, what we're doing now, again, trying to keep incredibly hopeful and optimistic, is that how we help make sure that everybody is talking. You know, all of the national campaigns are really helpful. All of the local campaigns are really helpful. I think we do have generally in our population now and in our culture a much more clearer understanding of mental health. There's been a lot over the last 5 years that's really supported that. The indicators for lots of these young people aren't even there. So they're not young people often that are even connected to our specialist service. Unfortunately, you know, the young people who are in the community. So I guess the work that's going on in schools, the work that's going on in local authorities, the work that's going on with voluntary sector in Durham, we're really lucky that we have If You Care Share, who've been incredibly helpful in, you know, supporting, sharing, training, you know, lots of workplaces, school education settings. So I guess how. It's such a difficult question to answer, because what we need every young person to be able to have somebody that if they are feeling whatever they're feeling, they can talk, they can reach out. That is the best thing that we can possibly do for all of our young people. Just make sure they have someone, and that someone, excuse me, doesn't have to be a family member. It can be anybody, but that's the message that I would be given. Because when we talk to young people who have made serious attempts on their life, you know, the bit that we always hear is that, you know, it was in the moment and they didn't really want to end their life. And I think we have to hold on to that, you know, that the message gets out that when they get those overwhelming feelings, we need them to be able to reach out, or we need them to have someone. So it doesn't answer your question. There is lots of work that can be done, but that work has to be throughout society. It's not any services independently. It's every single one of us. So sorry, I guess that probably got a bit more personal and passionate. But yeah.
Okay, thank you very much indeed, Michelle and Jennifer. These are complex issues, and I think they touch many of us, but thank you very much for that update, which was really interesting. And thank you to our colleagues from the Adult Health and Wellbeing Scrutiny Committee who joined us for that item. If we move on now to item 7, which is about child poverty in County Durham. And Karen Davison, who is the strategic manager of the One Point and the Think Family service, is going to present her report. So Karen, over to you.
Thank you, Chair. I shall just get my PowerPoint up, and I'll also be joint delivering this with John Mitchell, who you introduced earlier as our research officer.
Yeah.
Okay. Can everybody see that?
Yes.
Lovely. Okay. So good morning, everyone. I'm Karen Davison. I'm the Strategic Manager in Children's Services, and I'm responsible for the 1 Point, which is our early help service for children, young people and families. And I also chair the Child Poverty Working Group. I apologise, it was a very long report, and I will try and cover the key areas of our progress over the last year and our future developments as we go through the presentation. The working, sorry, I'll get the next slide. The Child Poverty Working Group's key priorities for this year have been identified as trying to understand the level and impact of poverty on children, young people and families in County Durham. And that's been really important, and we've worked very closely with John Mitchell, who's going to show you some of the data we now have, a much richer picture of the children that the children and families are impacted by poverty. And that's really important to help us to understand this, because that helps us to target our resources more effectively on those more disadvantaged children. It's also important that our practitioners across County Durham, the County Durham Partnership, have the skills and knowledge to help to identify children and families who are impacted by poverty, and also be able to get them the help and support they need at the earliest opportunity. A key priority for us was to try and look at providing support and services that will help us to narrow the gap in access to things like culture, leisure, sport and well-being of those disadvantaged children. And also, lastly, raising the aspirations and resilience of children and young people as they move in education, training and employment. I'm going to stop sharing now. And I'm going to ask John to take over and take you to Durham Insights to show you some of the rich data that we now have.
Right, thank you, Karen. My name's John Mitchell. I'm a research officer in the Public Health and in Research and Intelligence team. And I'm going to give you a quick tour of some of the data that we have published on Durham Insight around local data on child poverty. Hopefully you can see my screen now. Should be the home page of Durham Insight. Yeah. So as I said, Durham Insight is our main place for publishing all our analysis and data. So quickly, I could spend hours on this site, so I'll just quickly go to the relevant stuff. A lot of the data is themed, so we have a deprivation and poverty section, and under poverty we have various data sets that we've published recently to try and paint a picture of child poverty across the county. So the main poverty page contains links to various aspects of poverty, not just child poverty, but we have fuel poverty in the county, and there's the index of deprivation. The last time I was at one of these meetings with Karen was back in January. At the time, the local measure that we had been discontinued, and the latest data we'd had from that was for 2016. So we had no data at that time, up-to-date information at the local level. In March this year, a new data set was published to replace the old one, and it's provided a 5-year time series that covers the period of April 2014 to March 2019. And it's quite a rich data set. It's more robust, and as I say, once we got out a lot of the COVID data work out of the way, we were actually able to look at this, and the result is the page I'm going to show you now. So basically, it's a new children in low-income families measure, local statistics. One thing I'll say about this is it gives a view of child poverty. There is no one data set that gives you a definitive measure of child poverty. Rather, there are several data sets that cover different aspects, and the work that we've done here is to try and present those different data sets and see how they link together. So this one provides the first benefit of this, it provides very local level data. So we're talking about data published at the census lower super output area geography. What that means is we can take that data and then aggregate that data up to other geographies such as area action partnerships, wards, family first areas. It's a really rich data set which allows us to present this information in all these sub-county areas, which is quite rare in a lot of the data sets we have. This page basically explains the data sets. It provides also two views of poverty. We have relative poverty. Relative poverty is similar to what the old data set covered. So we were looking at children in families where they had less than 60% of the median income and were on certain benefits. The relative poverty is very similar to that. But what it also does is help us to look at that set of children and look at those ones that are experiencing a higher level of poverty. And that's where the absolute poverty measure comes in. So that's those children that are really in very high levels of poverty. So it's very, as I say, a very useful, comprehensive data set. And as I say, we've done quite a lot of analysis to try and provide different pictures and views of this, and it's all on this page. There's lots to go through, and we've provided information, and when it loads, infographics, which you can explore at your leisure to see how things have changed. There's information by age group, family type, things like that. One other thing we can do is, as I say, I'm going to come back to the deprivation one there, but is provide measures by different geographical levels. And again, you can explore the data in an infographic. It's by low super output area, but we also have in there by your wards, and you can actually go and access the information for your wards. As I said before, this was produced at the low super output area geography, which is very, very useful. As I say, not only allows this aggregation, but it also allows us to join other data sets to it, to look at how they are linked, the correlation, if you like, between these data sets. So we did some work on levels of child poverty by low super output area and the index of deprivation. It's not going to show you anything surprising here. All it does is reinforce what we already know. The scale is slightly in reverse. That's why we put these indicators on. So down at this end, you'll notice there is more of a concentration of high levels of child poverty in the more deprived areas. We all know this. This actually now provides us a statistical proof that that is true. And we've done it for both relative and absolute poverty. And again, as you can see, it's more clustered towards the more deprived areas. It's not rocket science, but it's great to see it in a pictorial form. It really strengthens the case that, you know, high levels of child poverty, more deprivation go hand in hand. So that was the first data set. The second data set, which is also available off that poverty page, is around some recent analysis that I've managed to do on free school meals. I obtained an extract from the Spring Census 2020 data set at the pupil level, and I was able to work some magic on it so that we could actually then look and aggregate the data up to different geographical levels. And it's provided us with something similar to the child poverty data set in what we can present. And what it looks at is children who live in County Durham and attend schools in County Durham, because as we know, children can cross the boundaries to go to different schools. But it's allowed us to produce quite a detailed data set, which again we can present at low super output area level and at electoral ward and at AAP, of where the concentrations of pupils who are eligible for free school meals are. And again, as similarly before, we have summary tables. This is the national data set, but we also have those interactive infographics that we're using quite a lot now, which again you can interrogate, and you can see the levels of free school eligibility in a particular area. And again, going back to what we did with the child poverty data, we can link it with other data sets because we've done this geographical analysis. And again, it's not telling us again anything that we didn't already suspect. It's just reinforcing our knowledge. High levels of free school meal eligibility are found in the more deprived areas. Simple as that. The data set also, though, contains some other information, such as pupils who had an SEN flag against their record, or So that's special educational needs flag or a educational health care plan flag. So again, we could actually map that data as well and set it against other data sets such as deprivation. Again, there's a higher levels of pupils with an SEN in the more deprived areas. This number here indicates the strength of that link. The closer that number is to -1 or +1, the stronger the link. So that's a moderately strong connection that we would say there. The other one was the educational healthcare plans. This one's a little bit more flat, but again, you can see there's more clustering towards the more deprived areas. And then, of course, everything. A child who has an SEN or a HCP and is eligible for free school meals. Again, this just is further evidence of poverty can take many forms and children experience different levels of deprivation and poverty. So that's again, they're all for everybody to explore at their leisure. One other thing we did as well is on this page, there's a link, if I scroll all the way up, it's quite a long page, to a web map. So this is the web map. So that's taking free school meal data and presenting it in an interactive map that you can interrogate. You can zoom in to areas right the way in and get really fine data down to street level. Just takes a little while to load. So right the way down, so I don't know if you can see that, but there's actually street names on there. If you click on an area, you can pull up context information on that area. So I've clicked on that LSWA just at random. It gives you information on that LSWA. You can scroll through to see if there's any near areas and have a look at your ward. And you can zoom into the area by clicking the zoom in button. It also provides you charts as well, similar to the infographics. So those are the two main data sets that I wanted to talk about in this presentation. And it's they're on the public side, free to for anybody to look at and explore. And it's a really good data set. As time goes on, I hope to provide a similar map to this for the child poverty and also develop a time series of the free school meal data. I already have the 2019 spring census, which I'm going to look at when I get some time. And then, of course, we've got hopefully the spring census in 2021 will go ahead. So we can actually, over time, build this up to a really good set of statistics over in a time series. I think the only other thing is to say it's the poverty on this page is not just child poverty. I said there's fuel poverty, but there's also general poverty that the general population may experience at times. And this is a high level. This is like high level view, county level or above. I won't go into it, but it's there for you to look at. And I think on the actual poverty side, I think that's about all I would like to say. The only other thing I would mention, which I'll briefly mention, is we are doing some work looking at the possible economic outcomes of the pandemic. And what I'll say about that is that we don't know what they are going to be. There's too much uncertainty. We don't know how it's going to affect our economy locally. We don't know how it's going to affect our unemployment rate. And quite often, some of the data that we use to define this won't actually be available to possibly the middle of next year or later. In fact, one data set may not be available till the summer of 2022. That's the gross household domestic income data set. There is a group looking at this, and one thing that we need to look at more closely is possibly people starting on universal credit. The assumption is that people start on universal credit because they are unemployed, but that's not the case. People start on universal credit for many reasons, and one of the primary reasons is that their financial situation worsens. And if their financial situation worsens, the level of poverty is likely to increase, and therefore the level of poverty that their children are in will increase as well. So that's something to bear in mind for the future. And with that, I will hand over to Karen.
Thank you, John. I shall put my presentation up again. She says. Anne, are you able to get my presentation back up, please? In case the other one. seem to have lost it. I don't know if I've closed it down. Yeah, if you can go on to the next page, please, Anne. Thank you. And everybody see that okay?
Mm-hmm. Yes.
So I hope you found that work quite interesting that John's done, and as you can see, it's clearly influencing and shaping what we need to do next and how we target vulnerable children and families. And we've got much richer understanding now of poverty across County Durham, and as I say, moving forward, that will help us to target our services and resources appropriately. So just to give you a bit of an update on where we have got in the last year, as you know, last year we developed a Cutting the Cost of the School Day programme, which was about supporting schools to understand the impact of poverty on children and families. Think about how children might present when they're living in a poor household, the impact on their behaviour, their presentation, etc. So to date, we've worked with 106 schools. And we plan to continue to deliver that programme. We're currently developing it into a virtual platform so we can continue to do it during COVID restrictions. Things like helping schools to see, for instance, single supplier school uniforms and the cost of those and the impact that can have on, especially on children families where there are a number of children. We clearly know that single supplier uniforms cost a lot more than a family going to a local supermarket and then being able to sew the school badge on. It's also helping schools to think about upcycling school uniforms, but not from a poverty perspective, but about, you know, the environment and that approach, which is much more, you know, less stigmatizing for families. This also links, our focus on schools also links to some of the information John's helped us to see. It's around that 5 to 11 age group, or the age group that are currently the increase in poverty is impacted on most. We're also developing a Cutting the Cost of the Preschool Day, so we can work with our early years providers and our childminders to help their understanding of the impact of poverty within their preschool setting. The provision of free school meals during COVID, as you'll all be aware, there was a national programme of free school meal vouchers for children on free school meals. This was up to schools to decide whether they offered that to parents or whether they wanted to keep their kitchens open and provide either hot meals that were delivered or packed lunches that were delivered, or parents came to pick them up. We're not able to give you any data on the uptake of the voucher scheme, given that's a national scheme. We are able to tell you that we've had a minimum of 1,500 new applications for free school meals since COVID impacted on us all. We also know that where schools have had a Taylor Shaw contract, that's about 200 across the county. At least 60 of those schools kept the school kitchens open and continued making meals and delivering them for families. And also another 55 of those schools made up packed lunches and sent them out to families. With regards, key focus of our work really over the last few years has been to develop a coordinated approach to providing holiday activities with healthy food across the county, and we continue to strive to do that. We have been given some funding from the Poverty Action Group and Public Health, about 250,000, to continue to develop and to deliver a comprehensive programme across the county, clearly targeting those areas where we know there are higher levels of deprivation and children on free school meals. Clearly, COVID has impacted on that, but I have to say, we're starting to get some case studies from providers that have continued to deliver these services, you know, with very, very creative, you know, doorstep performances, delivering activity packs, street theatres, etc. Through over Easter, we had 30 projects, over Whit we had 50, and during the summer we had 85 different holiday activity programmes right across County Durham. The funding is administered in and through our area action partnerships, although we have some central funding which we've been able to support providers like our young carers, Family Action, who've delivered a programme. My own service, the 1 Point service, delivered 1,400 activity packs, a lot of them associated with things like ingredients for families to make packed lunches and food. But we are currently, the AAPs are currently developing their evaluation of the summer programme, which I don't have to share with you today, but that will be developed by the October time. What I can also tell you is that public health provide us with some additional resource. So this summer we've been able to do a pilot to help off sort of future thinking around, and we've worked with 4 main providers and done some in-depth work with them about looking at things like the application form, looking at how we can support those providers to use school food standards, some school activity standards, and also to look at how we can capture the impact of holiday activities with healthy food on children and families moving forward. And that pilot has concluded. The report has been shared with the holiday activity group next week, and I'm really hoping that that will give us a blueprint for how we develop a much more coordinated and you know, quality standards across that type of programme moving forward. You will also know that the Department for Education provided the local authority with laptops for some vulnerable pupils, for disadvantaged pupils, those pupils on free school meals in year 10, for our care leavers, and any child who had a social worker who was not able or didn't have the resource of a laptop or an internet router to make sure that they could continue to access education during lockdown. Academies were provided with their own laptops, but we have had nearly 1,000 laptops distributed during that time. I just wanted to highlight is that my own service throughout COVID, we've been very aware of the impact of children being locked away with their families. Some of our most poorest children and families lack resources, they live in cramped houses. We were noticing significant the impact on the child and the parents' emotional well-being. Families felt very isolated, they didn't know what to do with the children, they didn't have activities. So my service set away developing and delivering on doorsteps a whole range of activity packs to help address emotional well-being, you know, physical well-being, nutrition, and we continue to do that throughout lockdown, and that also helped us to make sure that we had sight of vulnerable children, that we were talking to parents and we were talking to children. And we're just about to finish making a little film of that, and I'd love to share that at another scrutiny meeting. We've also done some work to make sure that care leavers have had an enhanced welfare assistance. So any care leaver that is on universal credit, whilst they're waiting for the universal credit to be processed, we'll make sure they get weekly shopping bags. They also will continue to get the winter fuel allowance and any discretionary housing benefit should they be on universal credit. One of the issues that we noted over COVID, clearly a lot of families being made redundant or being furloughed. We started to hear a lot of concerns from families about the new school term and them being able to afford school uniforms. So with the help of the Poverty Action Group, we now have a fund. We called it the Back to School Fund. That's being administered to schools. The amount of funds schools can access is based on the number of children they have on free school meals. And this is to help schools address their worries about the barriers of children coming into school without new school uniforms, PE kits, and also the impact of COVID, where children need their own resources, they need their own pencil cases, there's no sharing, they need their own water bottles. We just introduced that in September, and to date we've had 25 applications from different schools, 18 from primary, 6 from secondary, and 1 from special schools. And I just would like to stress, although the funding is based on free school meals, this fund, the schools can use their discretion, and it could be available for any family they feel are struggling, those families that we know are just about managing. And lastly, progress. We've, as you will know, the Healthy Start programme has been relaunched nationally, and this is a programme to support pregnant women and children under 4. It's about nutritional support in pregnancy and in young children. Children and pregnant women are given £3.10 per week. If the child is under 1, actually that's £6.20. Anybody under 18 who's pregnant will also be eligible for this. And this is when they're on receipt of any sort of benefit. The national programme has changed, so it's now a digital offer. It also enables families to have top-up cards, which means they can carry over their credit should they not spend it all in 1 week. And we're going to start a promotional and training programme for staff to make sure we can really increase the take-up of Healthy School programme across County Durham. Next slide, please. So what are our next steps? Well, we clearly need to refresh and revise the County Durham Poverty Charter, which I think I talked to you back in January. We need to launch that within the new COVID environment. Excuse me.
If you could wind up in a couple of minutes.
Yes,
Karen,
sorry,
please.
I'm just about finished.
Thank you.
We're exploring how we can best support the ongoing administration and management of the School Benevolent Fund, which provides grants to families eligible for free school meals on winter coats and shoes. We also want to explore the utilisation of surplus foodstuffs and expand links with existing schemes such as Fair Share and the bread and butter thing. We also are going to use the Durham Wellbeing Approach principles and apply that to the work that we're doing on child poverty. We're refreshing the cutting the cost of the school day with all the new data that we have and new services. And our next focus will be at making sure that we're working with culture, sport and leisure to look at how can we increase access and inclusion for our most disadvantaged children within those environments. And we also want to establish a number of youth hubs right across County Durham, and that's unemployment support for our 16+-year-olds. Thank you. I think I've finished.
Thank you very much, Karen. It's a very complicated subject. There's an awful lot of information to put across, but thank you, and thank you to John. So questions. First question, please, from Rob Crute.
Thank you, Chair. Rob Crute, representing the Blackhall Ward. I'm also Chair of the Corporate Overview and Scrutiny Management Board at Durham County Council. I was interested to see reference a couple of times there to free school meals, because I think that's one of the the provision of free school meals is one of the key drivers for child poverty in the county. Although we don't know if we've increased take-up rate through COVID, it'd be interesting to see if we can develop and perhaps learn from it. Because from the evidence in other parts of today's agenda pack, we know that whilst there's a high incidence of high eligibility rate for free school meals, there's a relatively low take-up rate, and I think that's having a bit of an impact across the county. Firstly, and perhaps most importantly, in terms of children's nutrition. We don't know if children on free school meals who don't take up that offer are they taking an alternative, or are they simply skipping lunch, which clearly has an effect on attainment and narrowing that gap in attainment between the high achievers and the low achievers. And secondly, given that there's a link between free school meals and pupil premium, is there a negative impact on school budgets? We know the hard pressed at the moment school budgets. To see that there could be an improvement made by increasing take-up of free school meals, be interesting to see if we could improve that. So although we can't have those figures yet on take-up of free school meals during COVID, I don't know if it's for you, Karen, or for John, to see if we can work through the evidence that we have to see if we can improve take-up, both for the nutrition of school children and for the benefit of schools. Thanks, Chair.
Thank you, Councillor Crute. I'll let John answer his bit. We've developed a way to get help and support for financial issues, and that was a corporate document to try and help workers and the general public to know where to go and get help. And I think what we've decided we need to do is something very specific for children and families, and it's actually we want to tackle that because we think there's probably about a stigma about applying for school meals, and actually families actually don't know when they actually are eligible. So we do need to do some work to help them understand when they are eligible, because the benefit systems, although it's I suppose it's more complicated because sometimes working parents are eligible for free school meals, but they actually just don't know that they are eligible. So I take on board your point, and absolutely we'll need to do more to help families understand when they can apply and how to do it.
Yes, thank you.
Yeah,
did John want to say something?
Yes, around the looking at free school meal eligibility, that's all I can report on because that's the only data I get. For take-up, I think maybe some more work needs to be done within children and young people services to gain that information from the schools. With regard to COVID, I would assume that the autumn census, which is supposed to be going ahead during this month, is going ahead. If that's the case, then it may be possible by Christmas to get another extract from the census and run it through the same process that I've done with the spring one, and then we can compare the two to see how eligibility has increased. And this goes back to me, the work I want to do is in developing a time series. So certainly we can look at that in the next couple of months once the data is published and freely available.
Thank you, John. Next question, please, from Leanne Kennedy.
Thank you, Chair. Councillor Leanne Kennedy, Dorden Ward from Seaham. Just a quick question around the data on free school meals, obviously in regards to people on benefits. Am I right in saying that up the years too, anybody, whether they're on benefits or not, receive free school meals? And I just wanted to know if them who were basically not in poverty but are eligible for free school meals are in that data. Thank you, Chair.
Thanks. Is that Karen or John's going to answer that?
I cannot really answer that one. All I can say is that the data is just there's a flag in the census. They ask if the child is eligible. I don't know what other information is in there. I don't know if Karen can maybe clarify that. I do know the rules have changed because of universal credit and became a little bit more complex. So.
Just because it might be a little bit misleading, mightn't it? If obviously if that's incorporated in with them figures, it'll make the figures that not incorrect really. If it's around poverty.
Okay, we'll pick that up, Councillor Kennedy, just to be absolutely clear.
Yeah, Thank you.
I think Stephen Tracy might know more about that one.
Okay, Stephen, you've asked, is this about this issue that you'd like to?
Yes,
please,
thank you,
please
Chair.
come in now then, thank you.
Yes, thank you, Chair. The people who receive free school meals who are not on universal credit are excluded from those figures. It's a national return collected by the DFE as part of their national school census, which is taken at one kind of snapshot in January each year. So yes, lots of children receive a free school meal because of the stage that they're at in their education, but they do also collect who's actually eligible for free school meals at that point. I think that's one of the challenges with this specific measure, because it is a complicated area. There's been lots of policy changes over the last few years, so maintaining a clear picture of eligibility against take up and then who's actually having a meal on that day is a mixed picture, but there is definitely concern on the latest information, and I think what we're trying to do is, as John's trying to do, is trying to triangulate lots of different information to present the fairest possible picture about what's happening in Durham.
Okay, thank you, Stephen, that's helpful. Next question, Ros Evans, please.
Thank you. I'm Ros Evans. I'm a co-opted member of this committee. I just wanted to ask about the laptops. We know that education settings, schools and the like, they mitigate the effects of poverty to a great extent, which is fantastic. But obviously, in the our recent experience of our children not going to school, there have been signs of increased in education inequality, and that happens pretty quickly. It looks like I'm a bit disappointed in the number of laptops. I thought from the media there were more laptops going to children, disadvantaged children, but there we are. I was just wondering about the future, because it is so uncertain, and it seems to be something that we can do, helping children have access to effective laptops and also connectivity. So there's two sort of aspects to this. You mentioned that the more laptops and tablets are being made available, but you don't put any figures on that. And I wondered about the long term, but also going back to data, whether we know about which families actually need this provision, and whether it does, and its relationship to disadvantage and poverty, which might not be quite the same, because it also includes access to effective connectivity, which doesn't necessarily go hand in hand with poverty. It also goes to where you live and such like. So it's really quite an open question about where we might go forward, and the opportunities to actually include this much more in your forward planning for helping equality as well as mitigating the effects of a disadvantage.
I mean, we do have a system, Ros, where any new child with a social worker, that social worker will obviously talk to the child and the family to ensure that either they have a laptop or they don't have one. And if they don't, we do have a supply of laptops to enable us to help all new children that, you know, come into children's services and have a social worker making sure that they have access to one of these laptops to help with that. Or if they've got a laptop and they don't have a router, then we can supply that router as well. So we do have enough laptops to help children that are coming into children's services at the present.
I think my question was a bit wider.
Yeah,
that this inequality actually goes beyond children with social workers, and that was one of the reasons why the DFE provided those laptops, but obviously only year 10 and so on. So it's more, and also if schools are going to go in and out and children are going to isolate, it's a continuing problem. We've got a new year 10 cohort and so on. So it's kind of linking, I suppose, the sort of social care aspect to this with the education aspect.
Absolutely, absolutely.
And recognising that,
yeah, it's definitely for care leavers, for children with a social worker, and also disadvantaged pupils. And you're right, it was year 10. And I suppose all I can reiterate, as we know, the government's priority is to try and keep schools open and try and keep, you know, education delivered in schools.
I mean, Karen, I'd heard that the children with social workers got their laptops quickly, but the children who were on free school meals and in year 10, one head teacher told me by the end of the summer term they'd had none. And you know, there was such a delay in getting them that it was a real problem. Are you aware of that?
Karen, do you want me to come in there?
Yes,
please. Oh, Martin, yes, please.
Yeah, so the ones that were administered through Durham County Council, I think we got our order in quite quickly and actually got our supplies delivered, and then on to children with a social worker or children in year 10 in maintained schools quite quickly. Each academy had to go through its own order process with the DFE, and then got its supplies. So I think there will have been staggered times at which different schools got their laptops. I know colleagues in education are sort of working with schools on that and trying to check things as we look at further periods for children needing access. And I think the wider issue that's been raised is about digital poverty as well, isn't it? I think that's something for us to be alert to and think about, because there are issues we know in some of the rural parts of the county about the adequacy of people's connections to do more than just basic conversations and things. I think that's something that we could helpfully look at in more detail as part of developing the child poverty agenda.
Yes, thank you, Martin. That's very helpful. Should we move on to the next question then, which is from Joanne Norman, please?
Thank you.
Chair, Joanne's on mute at the moment. If she can unmute her microphone.
Are you there, Joanne?
Sorry, I think there's a bit of a delay on mine, so I'll be unmuted and then muted again. It's Joanne Norman, I'm a parent governor representative. My question's in relation to the idea of utilising surplus foodstuffs and expanding links. It's just a question really about what evidence we have of schemes that increase access to affordable fresh foods and more healthier foods. I'm aware, you know, we have a couple of community fridge schemes. There's quite a lot of fair share schemes, but what you tend to find is a lot of the time that food, it's perishable, it's about to go, it's not always the healthiest of foods. And I think it would be good to see some evidence of more sustainable schemes, whether it's a like a food co-op or a bulk buying scheme where people can contribute a small amount and be able to get access to fresh meat or even frozen foodstuffs. So it's really just a question about, are you aware of schemes like that, and whether there's any sort of plans to try and develop more of those across the county, particularly in your more isolated areas where, you know, it's a good bus journey to get to a supermarket that you might only be able to do once a fortnight. So it's about making that healthier food much more accessible.
Yes, thank you, Joanne. Yes, we do want to expand the community fridge scheme, you know, right across the county. One of the other organisations we have been having discussions with is that bread and butter thing, which is a scheme around surplus foodstuffs, and they do provide up to 3 bags of food at a cost of about £7, and one of those bags would be fresh fruit and vegetables. But we're in early discussions with them about how we can bring that scheme into Durham, and I'd be more than happy to come back to committee and tell you how we've progressed that, because we are quite excited about it. You know, we will be working with VCS providers to look at how we would set set those schemes up across County Durham. But the good thing is that that would provide fresh fruit and veg in at least one of those bags, as well as, you know, household, you know, general food stuffs.
Thanks, Karen. And final question, please, from Joyce Charlton.
Yes, it's I know that across the county we have a decent food provision for children, but my worry is we're coming into winter and it's about fuel poverty. How can we help these families, because the vast majority of them will be on these ridiculously high charging machines, you know, card machines, which are an absolute rip-off. Yeah. They're disgraceful. And, you know, if families are having to do work from home, children are using more electricity, and they're going to get more and more into debt with these cards. You know, how can we help them?
Mm-hmm. I wish I had Mary Redman with me now, because Mary would probably be able to explain this a little bit more. Obviously, welfare assistance is absolutely, you know, the place where we can support families with fuel poverty. I think what you're suggesting is we maybe need to, Councillor Charlton, to be a bit more proactive in making sure that we help families to understand when they may be in fuel poverty and what support they can get.
Yes. Mm-hmm. Mm-hmm. It's more science. We tend to fixate on the food part of it, which is extremely important. But you know, I do think personally, from my point of view, I think we're a little bit lacking in information for people about fuel poverty.
Okay. Well, thank you for that. I'll pick that up.
Thank you.
Thank you, Joyce. It is an important point, fuel poverty. Yeah, thank you. Thank you very much indeed to Karen and John. It's an extremely meaty report and there's a huge amount in it, but it's a really important topic. And it's disappointing but not surprising to see some of the indices of poverty getting worse during the COVID crisis. So it's something we need to keep an eye on a lot in the future. So the recommendation is that this committee notes the report and comments on it, which we have done. So thank you very much. If we move on to item 8 now, and Stephen Tracy is going to present to us the Q1 2020 to 2021 Performance Management Report. So over to you, Stephen.
Thank you, Chair. Good morning, everyone. I'm Stephen Tracy. I'm the Corporate Equality and Strategy Manager. I'm going to talk you through a brief overview of your performance report. It's the first one we've done virtually and covers Q1, and it's got information from Q4 previously. This is, I think, the second time we've presented this performance report under the new format, aligning to the County Durham vision and the new County Durham council plan, to look at our 3 overarching ambitions for more and better jobs, for improving health and welfare of residents through long and independent lives, and ensuring a safe childhood for our younger residents through our connected communities work. So these ambitions help link a lot of the work of the partnership and the council together, so we can give a concerted push to some of the key issues that we've been hearing about. What I'll do is I'll give you a very brief overview of the things that are in the report, and then we'll go through a few questions that I can try to field as best as I can. As I mentioned, this report covers Q4 and Q1, which covers the period of national lockdown in response to the COVID pandemic. This had quite substantial impacts, as I think we've already been discussing this morning. And in terms of our 3 ambitions, the impact in terms of the economy is likely to be substantial. already seen, as John and Karen have presented, some of the concerns about the likely increase in terms of relative deprivation and poverty, and how we're going to address that going forward as a partnership, but also as a council. It is likely that we're going to get further economic stress, and it's likely that it exacerbates existing inequalities. So as a council, we've got concerns already about things like the disability employment gap, but also a kind of a rising of the unemployment rate for younger people. And all of this collectively adds to significant long-term poverty pressures in the council, as I think we've just been discussing in a bit more detail. In terms of the health and welfare impacts of the pandemic, we've also heard about the far-reaching impacts on mental health, and that's going to be a key concern going forward. And I think that colleagues from the T's and Escombe We Value Mental Health Trust have given you a detailed overview of some of the pressures and the demands in that area this morning as well. Looking at health and welfare a bit wider, over the longer term, we have seen some positive progress in certain areas. So overall, we've seen improved progress with stopping smoking, with the number of pregnant women and new mothers setting a quit date to stop smoke, doubling over the lockdown period. We've also seen positive progress with our Stronger Families programme. Generally, there's been a sustained increase in the number of families achieving sustained and significant outcomes to their early help programmes and social care programmes over the last year to 18 months, really. But we're now at around about 4,500 families turned round at the end of Q4, so that's it is real positive progress. In terms of the connected communities and the statutory social care elements and early help, we've seen quite a decisive and concerted response to the pandemic. The social distancing aspect and of how social care professionals can relate to children and families fundamentally affected how that service is delivered. So they've had to reorganise and rethink their models of support. And over the summer and the early spring, that's happened, and they've come together in new ways very quickly to meet these new challenges. On a practical level, the demand for social care over the last few years has been very high, and what we've seen over the lockdown is a reduction in the number of referrals, partly because the reduction in school activity. Lots of referrals previously came through teachers, but also a reduction in the number of our initial reduction in the number of referrals from community sources. We expect that to increase over the next few months as schools come back, and work within early help and statutory care teams is about planning for this, how this service gets reset, and planning for the next wave of coronavirus, which is something we've may already be upon us, but also some of the knock-on impacts that we've already heard in terms of mental health and getting support to families in the right sort of ways. There's a lot to cover in this report, so I thought I'd just give you a quick overview given the time that we've got, and I'll try and field as many questions as I can, hopefully with help from Martin and colleagues if they're able to answer too.
Sorry, I'd muted myself as well. Thank you very much, Stephen. Questions for Stephen, please. David Hall first.
Thank you. Just a quick question. I'm not sure if it's appropriate to this presentation, but would performance data like this ever be able to look at things like literacy rates and things like that? So I know that from my area, obviously there's a concern that there might be a dip in these things as a result of COVID, and also just generally, is that something that we can sort of track and monitor as part of this type of thing?
Specific literacy rates within the community are difficult to measure. We've got all sorts of attainment rates at different levels within education that get monitored at different parts of the year, but that's kind of not quite the same thing as literacy levels. That sort of thing can get addressed through what's called the part of the Joint Strategic Needs Assessment, which actually a lot of the work from that is presented on the website that you've just seen, that John presented earlier on Durham Insight. I don't know if there's anything specifically about literacy levels, but I can certainly go back and see if I can find something within either Durham Insight, or I'll ask education colleagues if they've got any views on that going forward.
Thank you, that'd be great. Thank you.
Thank you, Stephen. Are there any other questions for Stephen? Again, there's a lot of data in that report. Okay, looks like you might be getting off early then, Stephen. Thank you very much indeed.
Thank you, Chair.
Oh, no, hang on. Joanne has thought of a question, so come in, please, Joanne.
Sorry about that. I'm on a delay. It was just, I know it's probably too early, but there's reference to the Kickstart scheme within the report, and I'm just wondering if there's likely to be any monitoring of the jobs that are created, or the placements that are created, and whether they are offered more than 25 hours, you know, what percentage of them, because I know obviously the minimum requirement is 25 hours, but employers aren't obliged to pay for any more than that, or to offer more than that. So it would be interesting to see how many young people are offered 30-hour or 37-hour placements.
Yes, I think with new schemes it can be difficult to get an idea of how we're going to monitor it going forward, because initially things that are brought about quickly will count people in placements and sort of an outcomes potentially at a very rudimentary level. But what we'll try and do, and I know the people behind this from the council point of view, will try and reflect as much detail as we can at the point of reporting. It is an interesting programme. It will be difficult to, I think, get a handle on what impact it has quickly, because some of these programmes you can measure initial activity, but kind of the true impact about the benefits that it bring might not be felt for 2 or 3 years down the line.
Thank you.
Thank you very much. What struck me from this report is how our social work colleagues in children's services should be congratulated on the work that they've been managing to get done in an extremely difficult circumstances with the COVID crisis. I think they've had to adapt all their working practices, and their, you know, the indices on the infogram are really very good considering. So I think we should send our congratulations to them. So the recommendation is that this committee considers the overall position and direction of travel in relation to the Q1 performance, the impact of COVID-19 on performance, and the actions being taken to address areas of underperformance, including the significant economic and well-being challenges because of the pandemic. So I think we've done that with our questions. So thank you very much to Stephen. If we move on then to item 9, which is the Q1 2020 to 2021, the forecast of revenue and capital outturn, and this is going to be presented by Andrew Baldwin, who's the Finance Manager for Children's and Young People's Services.
Good morning. Yes, I'll just reiterate, Andrew Baldwin, Finance Manager for Children and Young People's Services. The report we're looking at now is for Q1, the forecast of outturns. So we're looking towards the year end, not the actual performance to that date, but as at the 30th of June, looking forward where we felt the Children and Young People Service would be financially come the year end. The headline figure we take you to in paragraph 2 is that we are reporting about a £2.9 million overspend. Now, put that in perspective, that's about 2.3% of the net budget for the service. Now, at this point, we'd highlight as we go through this report, the costs that we're discussing here are net of COVID related costs or savings if they come along. So, for instance, if there was a cost that has been identified and agreed that really is being driven by the current COVID crisis, this is going to be dealt with corporately outside the service's cash limit. So the figures that we're looking at here are what will impact on the cash limit position at the year end. Now, the service started out the year with a 0 cash limit. As a result of an overspend last year, we would have been in a deficit position, but the council corporately cleared the cash limit for the service at the beginning of the year end. Now, we mentioned that we're forecasting a £2.9 million overspend. If I perhaps direct your attention down to paragraph 12 and the tables there, we get an overview of how this position is occurring. Particularly in the first table, we would highlight some of the major variances that are leading to this. We have an underspend in the employees area of about 1.3 million, and you'll notice 2 material overspends in transport of 1.1 million and third-party payments of nearly 3.5 million. Now, third-party payments is using the SITFA terminology, but in the main, this relates to looked after children placements, those who have got a legal status of looked after, and some that don't, but their placement is being paid for by the council. The next table below that analyses which service areas are incurring these variances, and if I'm going to highlight the areas I think that are impacting most, you would look at the service heading that's referred to halfway down that table as looked after children resources. It's showing an overspend, forecast overspend of 3.8 million, and also towards the bottom you'll see school places and admissions, and that's showing an overspend of 825,000. That primarily is relating to home to school transport, the increased costs that we are experiencing as an authority in transporting our children to school. You'll also notice under there that there is an underspend against the head of education. This reflects a restructure that is needed to achieve a future year saving, but it was carried out early. So we still have the budget, but the saving has been achieved by the service. So we are seeing the benefit financially of that in the current year, although we would highlight that this isn't a recurrent saving. This budget would have to be given up in years to come. The next table just gives a little bit of narrative and a little bit more detail behind where these variances are arising. But really that takes us down to back to our headline position that of a £2.9 million overspend. Now, at the outset, we mentioned that these costs that we're reporting are net of the COVID impact. There are some major costs that are being experienced by the service as a result of this. In particular, we are seeing some increased pressure in the looked after placements. Actually, availability, which is driving the unit cost of some of these placements, is going up, as well as the demand on there. Conversely, from a financial perspective, what might look to be beneficial, but obviously has an impact on the service, we are seeing some savings that are a result of the current restrictions. While we are forecasting a home to school transport overspend in the cash limit, in the summer term, with the reduced amount of travel, even with the supply relief that was provided to the transport providers to make sure that they could continue to run once schools got back to normal, we were showing a significant under budget position of around £1.2 million. Now that obviously is offset against some of the larger COVID related costs, but overall there's about a net £4 million impact on the service that's being deemed to be attributed to the COVID situation. The next section of the report focuses mainly on, well, it focuses on schools. So we're looking at the schools' budgets, the position that they're in. Currently, we have 216 maintained schools across the council, and if we look down to the tables in paragraph 18 and 19, we get an idea of the budget and the forecast that we're likely to see against these schools. So to put it in perspective, there's a net expenditure that was initially forecast of around £230 million, which was funded in majority through the DSG grant of £220 million. And the schools were forecasting that they were going to use out of their own retained reserves around £8 million by the year end. So that would have taken their combined reserves of 16 million down to 8 million. Now schools are very prudent in their budget setting, in their forecasting. Sometimes it seems to be a little bit pessimistic. The school finance team worked through with the schools, and as at Q1 we actually feel that the use of reserves that they will use in the current year is more like to be around the £2.3 million mark. So that will mean that the schools overall going forward will have reserves forecast at the year end of around £14 million. Now schools have to, well, they are required to develop a balanced budget. Now by a balanced budget, it means that they set a budget which means that they can provide the service within that year with the funding that they have available for that year and access to any retained reserves they might carry forward. If their planned activity would lead to a retained reserve that's in a negative, i.e. it's overdrawn at the year end, they need specific approval from the Section 151 officer in order to press ahead with their planned activity. And if we look at paragraph 22, we can see 8 schools who were actually given approval by the Section 151 officer to do this in what's referred to as a licence deficit. So in that table, you'll see that of those 8 schools, what their opening position was at the beginning of this financial year. Most of the schools, except Windleston School at the bottom, were already in deficit at the start of the financial year. But the deficits primarily are increasing, but we see all 8 of those schools, if the activity went ahead as planned, would be in a deficit position at the year end. Probably is what is of note in paragraph 23 is that 3 of those schools, Bluebell Meadows, Walsingham and St Bede's, are expected to convert and become academies during the current autumn term. That will mean that the deficit position that's reported in this report will come out of it. The deficit still has to be covered, but it becomes the responsibility through this process of the new multi-academy trust that are taking those schools on. The next area we'll look at, again funded by the DSG, is the retained blocks that we have here in the council. Now this has attracted a lot of attention over recent years, primarily in respect of the high needs block. So this is the block of money that caters for school children who've got special education needs, whether that's increasing provision in mainstream schools or providing some sort of special school or alternative educational provision. If we look down to paragraph 28, we can see the overall of the 3 blocks that are overseen by the council, but the one we'll focus on is the one that's in the first detail column, so that's the second column to the to the left, the high needs block. Now that demonstrates that at the end of the last financial year, so the start of this year, the high needs block was actually in deficit to £5.7 million. Now that's following actually a contribution from the County Council reserves of £5.6 million. So that's the starting position in the current year. The funding has changed in the current year, but not substantially. But with the additional activity that we're seeing going through, we're still looking at overspending against the high needs block budget by just under 500,000, which would give us a forecast deficit come the year end of £6.2 million in the high needs block. Now, a 5-year plan is being developed. It's worked on by the council in conjunction with the schools via the schools forum, with the the plan and planned activity and actions to bring that deficit position back into a break-even position within 5 years' time. Now, there is substantial increases in government funding that is being confirmed and some that's been anticipated over this period. However, the demand, both in numbers and the cost of providing some of the special education needs, is also going up. So this is something that's going to have to be monitored and controlled very carefully. The final section of the report looks at the CYPS capital programme. Now we are early in the year if we're reporting on the 30th of June, but if we look at table in paragraph 32, we see we have for the service a £32 million capital budget. The actual expenditure to date is about 2.8 million, but as I say, we're early in the financial year. Just with the timing of the billing, we will see expenditure quite low, but also we would anticipate in any normal year that a lot of the capital activity would take place during the summer break. So we wouldn't start to see the bills coming through at this point of time yet anyway. However, as we would highlight, this isn't a normal year. You know, with the impact of COVID, I feel that the capital activity may be substantially reduced in the current year, but there will be a request that goes into MAL to see about having these budgets carried forward. That concludes the presentation of this report, but if there's any questions that we're able to answer, I'll be happy to hear them.
Thank you very much, Andrew, and for explaining your report so clearly for us. Are there any questions for Andrew? Yes, David Hall.
Hi, thanks very much. I've just got 3 quick questions, if it's okay. You talked about the schools earlier in deficit and some of them converting to academies, I think you said. I'm just interested to know what happens to the deficit at the point they convert to academies. The second question is just in the last kind of summary point table, what's the special provision capital fund? And then the third question is there's quite a bit of interest in some areas of the county in new builds and what's happening there, and sort of the government may be making announcements in relation to funding, and I know the council's been working really hard to try and bid for new funding with some significant successes, but obviously still more left to do. I'm just wondering what's happening around that and what the council can actually do to try and attract more funding, whether that's locally from developments or from the government. Thank you.
Okay, I do apologise if I'm getting up to shut the door. I've just had a dog walking. Apologies about that. I'll try and take those in order. The deficit position, the schools that convert to academy, what happens to the deficit? In many respects, that depends on why a school is converting to an academy. If it was under a DFE academising order, i.e. it's a school that isn't performing as well as it should, and they make a direction that it goes into, has to be undertaken by another multi-academy trust, then the deficit statutorily is written off and the council will bear that cost. In some of the other schools that are going over, it's at the discretion of the council and council decision what happens to that deficit. In the case of the schools that are being academised in the current year, they've, particularly in relation to Walsingham and St Bede's. This is a long-standing issue that's been undertaken, and it has been a deteriorating position. The multi-academy trusts are able to come in and hopefully maintain these schools and get them back to being able to operate within the within their regular annual budget. And in these instances, consideration is being given, and I think it's been approved to a agreed level that the council will also pay for the deficit as these schools transfer over. But then any other financial liability going forward then become the responsibility of the multi-academy trust that's taken over the running of these schools. There was a couple of questions on capital. The schools special provision funds, I think, was the question. Am I correct in saying that? The schools special provision capital funds was a fund that was made available for use in at the council's discretion, obviously in line with the funding agreement for special education. Now how that scheme was going to be administered was down to the discretion of the council with the input from the schools. So this is around special education needs. It could have been investment in individual schools where it was identified. I understand, and I don't have the full detail of all the schemes that are going ahead, but I understand this is a single development to put a additional special capital, well, an additional service into our special education needs at a special school within Durham. The final question, I think, was in relation to what I think is currently an ongoing process, and it's the government announcement or potential announcements of additional capital for new builds and replacement builds of schools. We are still going through the bidding process. There are, I understand, several schools across the council that have been prioritised to be looked at for investment or maybe even replacement. Those bids are still in the process of being finalised, and no agreement as yet has been come to as to where that investment will be across the country, and the investment that comes into Durham, which schools that will be focused at.
That's great. Thank you very much.
Thank you.
Thanks, Andrew. A question from Beatty Bainbridge, please.
Councillor Bainbridge for Chesley Street East. I would just like to ask you, Andrew, when you were on about the deficit of the schools, I had read something, I think last week on my phone, about Windleston joining up with Elmore School. So that will make a difference to the schools in deficit, won't it? Like the other three that joined together, and if you're taking Windleston out of that equation, that brings the schools in deficit down.
It would do, because we wouldn't, if that comes to pass, there would, on that list, there would only be 5 schools in a deficit position. Yes.
Thank you, Andrew.
Thank you. Are there any more questions for Andrew? Right. Thank you very much indeed, Andrew, for such clarity, really helpful. So our recommendation is that we note the updated forecast of revenue and capital outturn for children and young people services for 2020 to 21. Thank you. Item 10 is any other business. I haven't been informed of any other business, and so that concludes our meeting for this morning. Thank you very much to everyone who's participated. Thank you very much to the people who've presented, and that concludes our meeting. Thank you.
Thank you. Thank you, Chair.